Well, hi, everybody. Welcome to the Doctor's Call tonight. My name's AJ Willoughby. So glad to have you all with us tonight. I tell you, we've got some exciting news with our brand new product, the M3Z, which is the code name, lab name for it right now. That's not the official name, eventually what we'll have, but that's what it's called right now. And it's a sleep aid that I'll tell you, it is so much more than a sleep aid. And, you know, we've had a chance to hear about this product, and already people have been getting it. They've been talking about the sleep they've been getting and how refreshed they feel and what it's been doing for them, which is all exciting. But wait till you hear what Dr. Fred Templeman has to share with you that we're getting ready to go to here right now, tonight. I'll tell you, this is so much more than a sleep aid. Yes, it will help you in that, but it is so much more than that. And the things that he was sharing with me about what this is blew my mind, and I know it's going to blow yours. But those that haven't had a chance to meet Dr. Templeman yet, he is board certified in the United States, also in Canada, as a medical care physician. He's served numerous years in Canadian Diplomatic Corps with assignments in Haiti, Trinidad, and Barbados. And as a result, his experiences around the world, of course, he speaks numerous different languages, and has got a wide range of folk remedies that he learned about in those years of service. He's the world's leading authority on the amazing botanical and superfruit, the mangosteen fruit. If you haven't heard about that yet, I'll tell you, yeah, that's all in a whole series of its own. And he travels around the world studying botanicals and nutrients and teaching them to people and learning more about them. And we've got a chance to hear from him today. He is also the chairman of the Scientific Advisory Board for M Network. And we have the pleasure of him joining us tonight and explaining about this product and all that it does, so much more than a sleep aid. So Dr. Templeman, so glad to have you here. All the way from Thailand is where you're at tonight. Actually, morning time, your time right now. So thank you so much for being on the call.
Oh, it's always a pleasure, AJ. I enjoy it. Can you hear me well?
I can hear you. I can hear you.
Okay, good. Well, let me tell you about this. First of all, a couple of words about sleep. Sleep is, next to diet, the most important factor with regard to overall health, and it even has implications for mortality. So length of life and the lack of illness is related to having good restorative sleep at all ages. And people who have had infants know that they sleep about 20 hours a day. And as you get older, you don't sleep as much. But hopefully, if you can stay asleep long enough and not have to get up or be interrupted in your sleep, and you have the proper levels of sleep, because there are 3 levels of sleep. As I was saying, sleep is the second most important thing. And the fact of the matter is that about 60% of people every year as adults in the United States complain about sleep difficulties. So it's not always a constant thing, but at certain ages, such as advanced ages, it is a real problem for most people. And everybody knows what it's like to be without adequate sleep. The product that we decided to put on the market for a test, we did with a test group of about 35 people, and the results were good. And so we placed it on in the M Lab as an experimental product to see whether, in fact, it's going to have the legs that will allow it to be added to the family of products that we have in the M company. The important part about it is that it isn't a mixture of something that's been on the market before. I did quite a bit of research looking for things that had never really been used very much in a commercial manner, certainly not valerian and hops and all of these other kinds of things, chamomile tea, etc. It's not a new blend of old things. This is a brand new product. And for those of you who want to hear a real strange name, the active ingredient in this is called 6-methoxy-2-benzoxazoline. And it's a product that is found in the greens, if you wish, the very, very small portions of plants that are monocotyledonous. Now that's a special type of plant. It includes all of the grains and cereals, and in this particular case, it concerns corn. And this product is present only in the plant at the very beginning until it actually divides the leaves for the very first time. And then it disappears. And so it is cultivated in hydroponics, because what we're looking at are the greens of this plant, and it is hydroponically grown under organic circumstances, and the corn that is used is non-GMO. Those are questions that I've had from people who have asked me about it. Yes, there is science behind it. This product has 7 US patents, which are called usage patents. Now, a usage patent doesn't prove that something works extremely well. Those are clinical trials that do that. And this one also has a human clinical trial that was well designed, that had enough people in it to have statistical significance, and it had very good results, which I'll talk to you about in just a moment. But as far as the other things for which this particular element has had research, and for which the patents apply, I will simply quickly go through a list. It has US patents for antidepressant, for bettering mood, improving sexual desire or performance, adjunctive therapy for weight loss, appetite suppression, and adjunctive therapy for arthritis, fibromyalgia, diabetes, and anxiety. Now, adjunctive therapy simply means that you use it with other modalities in order to be able to have the kinds of results that you wish. Now, can you still hear me, AJ? AJ, am I still connected?
Yep, we're good.
Okay, good. I'm rushing through this. The product itself, or this ingredient, which is the active in the product, appears to affect a number of the neurotransmitters that are the ways that one neuron talks to another neuron in the nervous system of the body. It's not just simply in the brain, but in the nervous system of the body. But we are most interested in the effect on the brain when we're talking at this point about sleep. And the sleep study that was done, as I suggested, was a randomized, controlled, double-blind trial. And I'm going to dig up just for a second here. I've got to fiddle with my machine. I'm going to get the actual data and read to you from the study conclusions. Just a moment. But it was impressive. And that's why we decided to use it, because nobody else is using it. And it is not something that you're going to find across the counter in any particular store, whether you're talking about a chain store or a drugstore or any place like that. You're not going to find it. And there is research for it. Anybody who wants to know what the research is can contact me, and I will give them the information, and they can go look it up in PubMed if they wish. Now, the number of people that were in the study were adequate to be able to have statistical significance. They started out with 60, 52, completed the study. It was a 4-week study, so it wasn't something that you were going to just get a small amount of effect from, because those things can vary with the stress of your day. But this was a duration of 4 weeks, which is significant. And the information that they gathered was important because it didn't only have to do with sleep. And I'm going to read to you from the conclusion of this. These are the results. Compared to the placebo group, because when you're talking about a randomized controlled trial, you're talking about a group of people that are separated by random choice into 2 groups, one who receives the active and one who receives the placebo. Sometimes there's a crossover. In this particular study, there wasn't. And it looked at tension, depression, irritability, and the actual quality, etc., of sleep. And here's what happened when they crunched the numbers at the end of the trial. 8% of the people who used this reported and were measured with a tool well accepted in the world of social sciences called the PALMS, or the profile of mood states. And they had 8% less tension. They had 15% less depression. They had 25% less irritability, read/anger if you wish at that. They actually fell asleep 33% faster. So that's just about a third, meaning that when you look at how fast you fall asleep, that's called sleep latency. And it's the time between when your head hits the pillow and you try to go to sleep and the time when you are actually in the first stage of sleep. And so that was improved strikingly by a third of people who were there. Now, 50% reported that they had better sleep, so that their experience the day afterwards and during the time that they were sleeping, they felt, 50% of the people felt that they were sleeping better. But their sleep was also monitored with machines. Now, it wasn't an actual formal sleep lab, but it was a monitor that would look at the stages of sleep, and particularly at the rapid eye movement sleep, which is the dreaming sleep. And of those who had better quality sleep, in other words, how they felt the next day, it was 40% improved. So 50% had better sleep efficacy, 40% had better sleep quality, and 30% of them woke up fewer times each night, and they did keep track of the times that they normally woke up in a preamble period before they were actually given the active. They measured how long and how often they were waking up, and they had 30% fewer times each night that they were working up. And 24%, using this monitor, more time spent in deep REM sleep. Now, rapid eye movement sleep during the time that you're dreaming is extremely important for the recharging of the brain. And a lot of other things happen in that particular stage of sleep as well that are beneficial physiologically. But the conclusion of this was that overall, the results indicated that the supplement was effective in improving sleep quality and improving stress-related mood states in a population of moderately stressed subjects. These were people who were selected in the beginning because they had complaints of not only not sleeping well, but of irritability, mood disturbance, and other associated factors. That study was a number of years ago. The reports that we are getting from people who are using the product are indicating that they are experiencing not only sleep quality improvement, but also other benefits as well. And I will speak to you about my own personal experience. By the way, this is very, very, very powerful. In that little vial that you get, you have more active particles of this particular product, that the active that that I gave you the name for. We have more particles in that little vial than you have cells in the human body. More than 7 trillion. 7 trillion particles in that. So that when you spray it into your mouth and you simply rinse a little bit around in your mouth, by the time you've done that, it's already in your bloodstream. Because these particles are so small that they pass through the mucous membrane of the mouth. A few of them are going to be swallowed, obviously, but those will also be absorbed. But most of the absorption of this product takes place in your mouth, and that's why the effects are really very quick. For most people, about 20 minutes after they take it, they're noticing an effect by being asleep. Now, in my case, when I took the recommended number of sprays and I did go to sleep, I started having incredibly vivid dreams. And these dreams would actually in some cases for me, they were distressing, but they were vivid. Let me tell you, they were vivid. And so I reduced the amount that I was using in order to be able to reduce this. And now I take the product in the morning, because the greatest benefit that I have found is the benefit that is associated with anxiety and with a state of well-being or feeling good. I used to take a product in the past that had this similar effect on me, not for sleep, but for this kind of anxiety, because I'm anxiety prone. And I called it my what the hell pill. Well, I don't have a what the hell pill anymore, but I do have a what the hell spray. So when something ordinarily would be getting to me and I would be irritated by it, and I would worry about it, or I would either actually engage someone to talk about things that now they don't bother me. I can take the spray, and many of the little irritants of the day that previously became big things for me, I say, what the hell? And I just let it go by, and my days are better. They're significantly better. So we're going to see what the experience is generally with people in the M family to determine whether it will have the legs to become a permanent product. So I would encourage everybody that hears me tonight, if you haven't tried it, definitely try it. But try it knowing that it has a broader spectrum of application than simply being a sleep aid. Now, none of the studies, and there are, as I suggested, considerable information. There is considerable information in the papers that have been written about this. None of that is absolute proof. But the study that was done, the human trial that was done, is very acceptable proof of its effect on sleep. We don't talk about insomnia per se, because that's a disease, and we're not supposed to be talking about curing, preventing, or doing anything with the diseases. So we're not talking about necessarily insomnia. We're talking about mood states. We're talking about relaxation. We're talking about the quality of sleep for people who aren't getting everything that they want from this period of time when they're in their bedrooms and hopefully sleeping. So if you have questions, send them to me. You have my emails, both my personal email and my email at M, and I can be reached when I get back in the States by telephone. But if you want to talk to me, send me your telephone number by email and give me your time zone, and I will call you even while I'm still over here. And by the way, I'm doing some very interesting stuff with the major university that is doing the research on the mangosteen over here. That's the primary purpose of why I spend so much time here. That plus the fishing is great and the sunshine is nice.
Wonderful.
So that's it.
Wonderful. Well, now, Dr. Tippin, I want to ask you just real quick a couple things that
sure.
You mentioned, that some things, like I said, that I was telling people that really blew my mind that you and I were discussing last night. About the fact this is so much more than a sleep aid. And, you know, one of the things is that anxiety and depression. And I know we're not saying cures or anything like that, but the research that backs this up. And you even mentioned earlier about fibromyalgia, libido effects. So a better night in bed with your spouse. And weight loss.
Hopefully your spouse.
Yeah. And even weight loss. And there's research that backs all this stuff up, right?
Well, let's put it this way. Those are use patents. So that means that the Patent Office of the United States has seen enough science to say that it is reasonable to grant a patent to the owners of the patents and this particular product, to say that there's proof in preclinical studies about that. Now, I'm not aware of any other human studies other than the study which was done that I referenced earlier, the randomized controlled trial. So it would be a little bit overstating if we were to say that it's proof. What we would say is that the patent people have been satisfied that there is enough science to be able to grant a patent for potential use of the product in those areas as a
Awesome.
supplement.
So, all right, now Dave, our Senior Vice President of Communications, Dave Webb, is going to jump in, and he's got something to add here.
Fred, I have a question for you also. A lot of
Sure.
people are wondering about use by pregnant and or nursing women and children. Now we say, obviously, keep out of reach of children. We don't test for people under 18 years of age. So the simple answer is, because it's not tested, we're not making any, we already aren't making claims. But what about people who are pregnant? What about children? I know Ryan has talked about personal use in his household. Another gentleman who is very involved in the formulation has used it on multiple demographics within his own sizable family. How would you address that?
Well, I would say this. Anybody who has serious concerns needs to talk about this with their own personal physician and to make a decision based on the knowledge that that physician will have of the individual themselves and the information that that physician could be given that would justify him making a conclusion or her making a conclusion and a recommendation. So if you're really worried, that's where you go and ask. But let me tell you where this acts in the nervous system. It tends to modulate the level of a neurotransmitter called serotonin. And this is the same neurotransmitter which is modulated by many of the antidepressant medications which are on the market. And they are not precluded from use in nursing mothers. Now, with pregnancy, I always believe that it is wise to be particularly circumspect in what you do in pregnancy, not necessarily because any of the supplements that you may use in pregnancy are going to cause a problem, but if the pregnancy does not turn out well, the potential for a horrible kind of depression called postpartum depression, which is really resistant to treatment, is real. And so if a mother who particularly had a pregnancy up until now, or is in her first pregnancy, or perhaps has had problems in other pregnancies, uses anything at all that's new, whatever, she's going to beat herself up if there is the slightest complication that arises. So my personal suggestion to my patients would be, if you're pregnant and you're worried about it, unless you're absolutely being deprived of sleep, I would not start anything that would be new during a pregnancy. Now, that's just my personal thing. There's nothing that is in writing that says you can't. Your doctor may give you different advice than I'm giving you, but that is what I would say to my patients, and to lactating mothers, no problem, in my mind.
Awesome. Wonderful. So there you have it. You know, we've got a product here. It is so much more than a sleep aid. We're having so many testimonials already from the people that have gotten a hold of this product right now, who are seeing it change their sleeping habits and getting such a better night's sleep. But what we're seeing already and what we're hearing is that it does so much more. Everything from the research on it that it goes for helping with anxiety, and of course libido, and so many other different things. And
well, everything that is affected by melatonin in the body, because it modulates melatonin and it primarily modulates serotonin, and that's a neurotransmitter. Melatonin is a hormone, but both of them produced throughout the body, the melatonin in the pineal gland of the brain, but extremely important. And people know that melatonin is something that people can get across the counter, and they use it for sleep assistance. And so this modulates it in a very different way. It isn't just giving you melatonin, it's actually modulating the way the melatonin is produced.
Wonderful. And to get this product right now, you've got to be a member. If you're not a member yet of M Network, then it's hard for you to get this product. You got to know a member who will go and order some for you is probably what you have to do. Because the thing is, to get it and get it at the wholesale price, you need to be a member, because right now this is an M-Lab product. What that means is something that we've got a brand new product that we're putting out there, code name M3Z, and we're going to see how the sales and how if everyone really wants this type of a product that we already know gets those results, then it will continue and it will stay as one of our main products. But it's going to be seen and make sure that, you know, it's something that people want to go buy and people are getting.
The next step, of course,
retail pages. Go ahead.
That's correct. That's what I was going to say. It isn't yet available for retail, which is why it needs to be picked up from members, because it is an M-Lab product, and that's available and is not distributed widely like an accepted product that we've already approved and is for sale.
Dr. Templeman, thank you so much. Appreciate. I know you're all the way from Thailand, and it's early morning where you're at right now. And here we are in the evening here in the States, and in Australia. I think it's in the afternoon, early afternoon right now, I think it is. So appreciate you being on and giving us this information. Anything else before we go? And I know we've got some more exciting stuff that we're going to shoot over to Dave Webb and let him tidy things up here with some really neat stuff to talk about. But do you have anything else to add for us?
No, AJ, except to let everybody know that I'm available for any further questions that they may have, and they can find out how to contact me without a problem. And again, I apologize for the difficulties with my internet.
We got it. Hey, it worked throughout the rest of the time. So, well, Mr. Dave Webb, what is going on, and what do we have to talk about tonight with the convention?
I'm glad you asked. I'm glad to have invited myself onto the call. Let's be clear. I invited myself. I saw an opportunity and I said, Fred's going to draw a crowd, so I'm going to jump on and we're going to have some fun with this. The biggest news we can share, number one, the M3Z product is available on retail. Members get it for $19.95 with 15 points. But we do have M3Z available for retail purchase. The M-Lab in this case has been open to the general public. So if you have retail customers who are not yet members of M, they can purchase the M3Z for just $24.95. So that is piece of information number one. Number two, we are going to have a special drawing for those who purchase their convention tickets in the month of February 2018. Now, I don't know if you follow us on Facebook, if you've seen the M University page, if you've seen the M Events page, we have been, and even if you're calling in on the phone lines, we have a promotion that we say, mention convention. We don't want this opportunity to slip by, because as of tomorrow, let's see, Wednesday night, tonight is Monday night, as of Wednesday night at 12 midnight online, Mountain Time, the price at $99.95 will cease. It will go at 12:01 seconds on Wednesday morning or Thursday morning, the 1st of March. That price will go to $149.95, still with 30 PV. And that is available from that point on through the end of October until the actual date of the event. Now, $99.95 is the price of a single ticket between now and the end of February, so another 2 days and about 6.5 hours. And then after that, it's $149.95. Now, anybody who signs up or enrolls between now and the actual event, you still have 30 days after your enrollment date to get the $99.95 price. We're not going to penalize, for lack of a better word, we're not going to penalize someone who doesn't even learn about M until June 2nd or March 2nd. There is no penalty for that. Just because you happen to have got in, you still get to be invited to the convention at the $99.95 price if it's within your first 30 days of enrollment. But again, to remind you, the value of signing up right now, buying your convention tickets right now, you get an entry to be drawn for a free night's hotel room at the M Resort in Las Vegas. Again, the M Resort, it was just circumstance. They thought our company sounded cool, so they named their resort after us. or something like that, maybe the opposite of that. But there is an M Resort. There's a picture of it on the screen right now. Their logo's a little funky, but aren't we all? And it's going to be a blast at this event. Trust me, the first convention is the thing that everybody talks about. And being there with at least one free night on your loving company, Ryan Anderson and team, we have decided this drawing is something that's going to have a great effect. So again, every ticket that is purchased for the convention, from whenever we announced it until the end of February, we're going to have a drawing, and that is one entry for every ticket you purchase. Some people have already purchased some 10 packs. Congrats, high fives and hugs from us, by the way. Those 10 packs get 10 entries, by the way. So when we do the drawing for February, we're going to say, randomly running our hands through the giant pile or bowl of names and entries for people who have purchased a ticket. We'll pull out a winner. We'll call that winner. We'll probably try and do some kind of an online celebration where we record the conversation. So make sure you don't have froggy voice if we wake you up when we call. But we're going to give away a night's stay at the M Resort. Now, we also have a room block. This is for everybody wide open. We have a room block with a limited number of rooms available. I will tell you that it is more than 6 because there are 6 of us at the office who want to go. So we got more than 6 rooms. we have a number of rooms. So you want to make sure you get that deal. I want to say it's $149 a night for that number of rooms. And again, I don't want to lock myself into saying how many it is. Just know that it is limited, and you're going to want to move on that, because if that gets snapped up by people in the next 10 days or 2 weeks, then you're going to be at their regular price. And I've seen prices go up to around $205 per night. You're not required to stay on site. It just makes it convenient, very simple. And all the energy is there. We want all the M energy there with us, and we'd like you to be with us. So again, get your tickets for convention before they go up in price on Thursday. But I can promise you, on Thursday, I'm going to be just as excited to sell the $149.95 tickets as I am to sell the $99.95. I just want the people on this call and the people paying attention to get this deal before it expires in just over 2 more days. So make sure you get ready for that. Watch for the drawing. We'll be pulling out a winner's name from a hat in the next couple of days within the end of the month, and we will celebrate with you, and we're looking forward to having you there. The inaugural convention, oh buddy, get ready. It's going to be something awesome.
Awesome. Can't wait for it. And again, just to restate, so the M3Z is, in fact, available on your retail sites where people can go and order it online.
Yes.
It is, to find it, you go to the packs. That's where it's at right now.
Yep.
So if you're looking for it, look at it. It's its own pack of one at the moment. That's a pack. But go to it. That's where you're going to find it. When you go to your retail site, you'll find it under packs.
$24.95 with 15 points of volume.
$24.95. All right. Awesome. Thank you, David. Anything else?
No, sir. We love you all. We're grateful to be with you and partnered in this great journey. Ryan Anderson sends his regards. He's traveling at the moment, but we have got some phenomenal things planned for right now, for March, for coming weeks and months, and certainly we're getting ready for that cruise and getting ready for convention. So 2018 is en fuego, everybody. Keep it up. We love you. Hang in there.
Awesome. Don't forget, next week, we've got some incredible stuff we're going to be talking about next week. We can't tell you tonight, but we'll be letting you know as we get closer to it. So you don't let any of your people forget about this call, the doctor's call, the product training call, exciting news and features, things that you hear every Monday evening. And tomorrow night, Ryan Anderson is going to be on, and he's going to be talking about training and talking about how to build your business and get some top-notch training on how to get your business going from our CEO of M Network himself, Ryan Anderson, and guests that he has on from time to time. And you don't want to miss that. Anything we need to know about that, Dave?
I say always remember mnetworkcalls.com. mnetworkcalls.com. That tells you when the 3 primary corporate calls happen. Also in your back office, if you check the calendar out, there are a couple of other calls that are listed on there, a couple of distributor calls. And we encourage you to remember mnetworkcalls.com is kind of the fallback default standard. This very call tonight will be recorded, and we'll prep that for posting within the next, I'm going to say within the next hour or so. and then we should be ready to get you guys on. The Saturday morning call with Dennis and Sue Ligon and JD and Ronnie Phillips. Always great information there for building your business. So the M Network community is huge and growing, and we're all thrilled to be part of it. So thanks, everybody. Thanks, AJ, for hosting, and for the great job you and Jill do. We appreciate it.
Thank you very much. Everybody have a great night. Thank you, Dave. Thank you, Dr. Tippleman. Everybody enjoy. We'll talk to y'all later.
Thanks, everybody. Good night.